Well, let me start and say, again, thank you for being here tonight. Just the fact that you are taking the time at this crazy part of the year to be here and to learn about how we can keep our kids safer shows your commitment, and we thank you. I'm Valerie Horvath, the founder of Balance in Mind. Balance in Mind was started to educate the community about the mental health of our children, to normalize the conversations around mental health, and to connect our community with resources, all three of which we will be doing tonight. Our events are open to anyone, anywhere, and we encourage you to share resources that we send you or notices of events with others that you think would be interested. Recordings of our events are always available on Facebook and our YouTube channel after the fact. Tonight's forum is the third in a series of conversations that we've been having about the intersection of mental health, substance use, and safety or harm reduction. We have 90 minutes tonight to give you an overview of what is happening right now and how you can work with others in the community and your family to help provide a safer environment for our children. Christy Nicholson will be moderating tonight, and if you've attended one of these before, her face will be familiar. She is with Youth Eastside Services, a local community health organization, and she has extensive experience in mental health and substance use counseling. She is the director of school-based services for Lake Washington School District both elementary, middle school, and choice schools. And YES also runs support groups and has substance abuse specialists, intervention specialists, I'll get that right, available for middle school and high school students. As a side note, high schools do have their own mental health professionals. They're just done through Evergreen instead of Youth Eastside Services. So thank you, Christy. I'll go through quickly and introduce everyone else. Rob Davis is a Lake Washington High School parent. This January, he tragically lost his stepson, Oliver, which is what actually prompted us to bring this series of What You Need to Know community forums together. Again, it's this intersection of mental health, youth, substance use, and safety. And he's sharing tonight what he wishes every parent will take away and needs to know out of his experience. Delaney Notneris is a social worker, substance use, and co-occurring disorders counselor with Youth Eastside Services. She currently works in the Lake Washington School District middle schools on SBIRT, which is screening, brief intervention, and referral to services implementation. Delaney believes in holistic and collaborative approaches to counseling, loves using stories, pop culture, and media as tools in therapy. Isabel Sakamoto is the Suicide and Injury Prevention Program Manager at Seattle Children's, and she supports suicide and injury prevention initiatives, including safe firearms storage, education, and community outreach. This applies to her work, I should say, applies to baby through teenage, 18-year-olds. Having a mental moment there. Alyssa Shaw is the Extreme Risk Protection Order advocate for the Regional Domestic Violence Firearms Enforcement Unit. And she had a much shorter title, but of course I can't remember that one at this point. But we are excited to have her join us to talk about extreme risk protection orders. Prior to joining this unit, she was a victim advocate in the domestic violence unit working on criminal cases and has experience working with survivors of intimate partner violence, sexual assault, and family violence, which, as we all know, can occur at any age, teenage, younger, or adult. So thank you everyone for joining us. I want to go quickly through Our disclaimer, which is that our forum is purely for educational purposes. There is no intent to form a client-therapist relationship. The forum, any services associated with it, including office hours, social media posts, and any other form of communication, are for educational purposes only. If you need immediate support or are in crisis at any point, text 741-741 for the crisis text line, or you can call Crisis Connections at 866-4-CRISIS at any time. And Crisis Connections, as well as the crisis text line, have services in a variety of languages. Please know that this is a safe space and you can be honest, but we ask that everyone be respectful and kind to each other. As always, please ask questions. You can ask questions at any time using the chat box or anonymously in the question and answer box. Captioning is on, and just choose live transcript on your Zoom client, which may be in the More menu. And with that, let me turn this over to Christy. Thank you so much.
Thank you, Val. Yes, as Val said, this is the third in a series where we're trying to really help parents in the community become more aware and more prepared to really understand the dynamics that are going on with our youth and with their choices. And oftentimes the dynamics with our youth are not that different from the dynamics that we have. And so earlier we were having a conversation about the pandemic and sort of how the pandemic has put everybody in a bit of a pressure cooker. So whatever you went into the pressure cooker with, right? Your history of, might be trauma, might be distress, might be financial struggles, difficulties, history of dealing with anxiety, depression, balanced out, of course, with all of the strengths and resiliencies that you also went into the pandemic with. And then there we sat, most of us for many months, kind of in our homes or home offices, adapting amazingly well for the most part, but all of us to some extent, if you think about kind of a whole spectrum, have been impacted in terms of when we think about kind of our emotional and even our physical wellness. And I think that's one of the cultural shifts that we're talking about trying to make for ourselves and for our community, and particularly for our community of parents and our kids, is that shift of thinking about wellness and thinking about wellness in all of its dimensions. And so when we're thinking about safety, for example, I know that the PTSA had an event earlier and they looked at things around safety, primarily about, there's water safety, there's bike safety, there's all car safety. We all teach our kids, stop and look both ways before you cross the street and all these things. And all these things are normalized. They're standard. We do them as a matter of course. And then all of a sudden, when it comes to alcohol, substance use, mental health, emotions, firearms and other kinds of safety issues, we all just sort of go, oh, we don't know how to talk about that. And it's somehow different. Well, we're really wanting to encourage everybody to normalize having conversations about this. It's not about trying to tell other people what to do. It's really more thinking about what are the issues, being informed, deciding for you and for your family, what your values are, where your boundaries are, how you're going to practice safety, and then communicating that out to your youth, to other parents, and having this really become part of, it's a safety conversation. Of course you would have it. And we're at the end of this tonight, going to kind of play around with some examples about that, about breaking down kind of the awkwardness of that. And you will hear from our speakers that we don't always know when somebody is at risk, right? Our young people, teens, for a lot of different reasons, they keep things kind of close to the chest. One, they love you and they don't want you to be upset or scared or worried, Okay. 2, they want to protect their ability to do what it is they're going to do. 3, they don't want to get in trouble. And they don't want to disappoint you. There's a lot of different reasons that they have for not always telling us what's going on with them. So the best case scenario is really to just have it be standard that you prepare for circumstances where somebody's mental health wellness is vulnerable. And right now we can assume that kind of that's more likely for all of us than at other times, and take steps to kind of build in as much safety as possible around that. I'm going to invite Rob to share kind of on the basis of, his experience with the loss of Oliver, what he really, from that unique position, wants you to understand and know as you're listening to the speakers tonight talking about how to provide safety around medications, substances, and firearms. Rob.
Good evening. My name's Rob. This is my third forum I've spoken at. The reason why I'm here tonight is just to tell you what happened. Not tell you what to do, not tell you how to live your life, but I'll tell you what happened with me and Oliver and my wife and my family. So January 4th, 5 months ago tomorrow, we just got back from Orcas Island. The family celebrated Benjamin. He's 13, it was his birthday. Had a good time, came back. Oliver was in a great mood, didn't act funny, didn't fight, played all the games. Just his regular old self. At school Monday morning, everything seemed fine. The whole family was there. At 2 o'clock, Ben and Mom just ran 5 minutes down the street. Oliver came down, grabbed some Christmas decorations for me to put in the attic. I saw him, said, "Hey, can you do this for me?" He said, "Not a problem." Ran back upstairs. At 15 minutes after, Ben came down telling me that Oliver was hurt, fell off the ladder. 2:17, I called 911 and I got to the room and Oliver was bleeding out. He had, I didn't know it at the time, but he had found one of my firearms, a 45 caliber ACP, and pulled the trigger. So I gave him CPR till the police showed up and the ambulance showed up. Didn't realize it was my gun until we flipped him over to try to give him CPR. Absolutely I was in terror watching Oliver die. I was even more in terror when I recognized my gun. Had no idea that Oliver even knew that gun existed. I had 10 years ago, a custom built hidden compartment in my walk-in closet built that nobody knew about. Well, Oliver knew about it. So there's just, I would have never thought in a million years Oliver would have found it. Clearly I was wrong, dead wrong. I did have in the house some gun locks that I did not use on that gun because I thought that there's no reason for Oliver to go to my closet or Benjamin. Elizabeth didn't, my wife, she didn't know that compartment was there. She didn't know the gun was in the house. So after all was said and done, we figure out, he somehow found the gun, he used the gun. He didn't seem to be depressed. He'd been doing drugs. We thought it was only marijuana. Subsequently, after the police and I and everybody deep dived into his computer and his phone, realized he'd been doing a lot of drugs and LSD, mushrooms, bath salts, all these things that I would have thought I would know. I'm in an active recovery. I've been doing drugs way too long, and I would have thought I would have caught on to this, but I didn't. Looking back at the gun, because that's what it inevitably it comes back to a lot, is when I'm trying to talk to people about what happened with Oliver, about the mental health, about the possibility that COVID had something to do with it because he was alone, all these things happening. His father died. He hadn't really, there was just all these things. But people really want to focus on that gun. And the reason why they want to focus on that gun not being technically secured was because that's the easy monster in the room. Nobody really likes talking about his mental health and what he could have possibly been thinking about when he did that. He saw what happened to my wife and Benjamin when his father died and left unexpectedly. He knew the destruction that an untimely death would cause. That's why it's so hard for me to believe that he just did that, because he saw the destruction. But when you try to explain that to people, or explain that he's 17, he's got college, he's got all these, people they look at me and the gun and they really want to focus on that. They don't, the drugs, like how could drugs make you do something like that? Pot's just so easy, you know, but it's not that easy. The drugs there's so many different aspects to this that I want people to focus on. And the gun is definitely one of them. So I'm sure one of the suicide people and the gun prevention people have the statistics on this, but had Oliver just had this flying whim or had a bad trip on acid and just 10 minutes after I saw him, found my gun and pulled the trigger, if that gun would have been locked or it would have been not in the house, he would have had to do it some other way. And I know this is cold and calculated, but I tell you what, when people find out that Oliver used my 45 to kill himself, it's cost me my wife's family. They won't talk to me. They have demanded that she divorce me. They want me to sell my house and to leave. And that's because of the gun. It has not, they bypass the mental issues. They bypass the drugs. It's just so much easier for that gun to be the blame and the monster in the room. So if you can, so what Christy and Valerie asked me to do is, if I could leave you guys with anything, here's the thing. The gun that they gave, the gun lock they gave me when I bought that gun 15, 20 years ago, maybe even longer, was a little chain with a little lock on it. I timed it because my wife's family, you know, my fault with the gun. So that would have been the lock I would have had. And I timed myself to see how long it would take me to break into it. And it was less than 5 seconds. So it's not it wasn't the gun lock. It was, but if I had a real gun lock on it. So I've looked it up. I've done a lot of deep diving into this. If I would have had a $20 gun lock on it, he would have needed a key. However, that key probably would have been on my key ring. Key ring probably would have been sitting on the counter, on the table. So he probably could have got it there. There's just so many. I mean, the solution would have been gun safe combination that he didn't know, probably. But if Oliver wanted to die, I'm sure he could have figured it out. But he would have figured out a different way, and where people would have been maybe more focused on the fundamental problems of what was going on in Oliver's head. And he'd stolen my car the previous May and took it on a ride down to Portland for some unknown reason. He got way too high. We had no idea. Crashed the car going 100 miles an hour, almost died, but didn't have a scratch. He should have died. He's got a firsthand knowledge of what happens when he takes drugs. He just flipped out. I didn't even yell at him I just went down and got him. And he should have learned. So that's a mental, instead of slowing down, after Oliver died, I got his phone and his videos and all this stuff, and he completely escalated it. And that's a drug addict, that's an alcoholic, and that's somebody with mental problems. And those are the things you guys should all know. When this all started coming out, his mother had no idea of the things he was doing. I suspected some things, but nothing like this. I didn't suspect LSD, bath salts, methamphetamine. I didn't suspect any of that. I got into his Venmo accounts, his Snapchats, all that. I found out stuff about Oliver I never needed to know. So if you're going to learn something, number one, lock that gun up for real. Try to break into it yourself. If you can break into it, that kid can too. That's the one thing I want you to know for sure. Check their phones, set boundaries. If they screw up, drop their grades, because Oliver's grades started going down a little bit. I should have set a boundary that if you start screwing up in school, that I'm going to go into your phone or your bedroom or give you your analysis, any of these things. But I wanted to be the good stepdad. I didn't want to be bearing down on him. I've lost 2 brothers and 1 sister to drugs. I knew that this was a possibility, and yet it still happened right underneath my roof, and I got to watch him die. So if you suspect, and if your kid was friends with Oliver, just know that they were probably doing some fishy stuff. I've talked to a lot of the parents and gave them some information, but just know that my wife thought Oliver was an angel. A lot of people did, that he would never do any of the drugs that he did, or never break into places, never steal, never hurt people. You never want to believe this about your kid. I didn't want to see it as I'm watching the videos, because that's what they do now. They videotape them doing these stupid things. So just keep your eyes open if you can. Pay attention to the things that your kids are saying, even when they're not saying a word. And maybe you can catch the stuff that I missed. I will never be able to forget that day and all the things that we're missing. I mean, graduation's this week, I think. We missed that. I got a email from the school yesterday. Oliver wrote a letter to himself his first week of freshman, or excuse me, his junior year. And he was supposed to open it up the day he graduated. They want to know if I wanted it. So I had to go get the letter he wrote to himself a year and a half ago. That's heartbreaking. And it's sad.
Yeah.
But don't be in my position. Lock that gun. And if you think it's safe and secure, try to break into it.
Thank you,
Okay?
Rob.
And that's about all I can say. There's two other videos of this of me talking in more detail about what happened. You can go look them up. But if you have any questions, everybody has my contact information. I have no problem talking about the situation. Just take care of your kids, love them, because you never know. Thanks.
Yeah. And I'm just going to kind of summarize a few things there, Rob, that I heard, which was, you know, and this is another cultural shift, right, is to move away from the not my kid, because you can assume that if any youth are doing it, then likely it's possible that it is at least confronting your child and they're having to make decisions around it. So don't ignore it and don't make those assumptions. Also, there aren't bad kids and good kids, right? I mean, I've talked with people who knew Oliver at, you know, the Boys and Girls Club everywhere. I never met Oliver personally, but I just have learned that Oliver was a delightful person. And Oliver had experienced a trauma with the loss of his father. You know, Oliver was struggling. You know, substance abuse is on board. That's why we included that, is that is sort of another pressure cooker where that just adds fire to anything. And I think, you know, kids turn to it to sort of help them feel better in a lot of ways, or to have fun, et cetera. And Delaney's going to talk a little bit about that in a minute. Much like adults do, you know, your cocktail to relax and all those things. And for some people that takes over. And for young people in particular, they're very vulnerable to that because their brains and their bodies are still growing. And as Rob said, you know, we've discussed these in more details in some other venues. I think we can work to buy that time, right? You know, so that we can't prevent everything. We can't control every element of anybody's life, even our children. So we can't 100%, you know, be sure and control, and really wouldn't want to be living that way anyway. If you think about that, if somebody was intent on controlling your every moment to keep you safe, you would probably not be enjoying your relationship with that person. And the same thing is true for you and your child. You need to have a positive relationship. It's always worth building that. And you can take a lot of steps to prevent and to sort of build in that cushion of time if there's that, if things aren't going well and there's that impulsivity, et cetera. And with that, you know, minimize the risk. And thank you, Rob, for making that real for us. I think sometimes these things just seem like abstract concepts when we talk about them. And I think it's hard to grasp that, no, this happens to real people and they're not that much different than I am or my family or my child. Thank you again. Delaney is going to talk with us about safety and security and kind of building our awareness and being aware around medications, over-the-counter medications, as well as prescription medications and other substances. Delaney.
Thank you, Christy. Yeah, so like Christy was saying, the idea of why we're talking about all these different things today is to put that stopgap, that moment of time in place. So I am going to share with you all about over-the-counter over-the-counter drugs, prescription medication, and other drugs and substances. Again, like Rob mentioned, there are several other videos that we've done so far that go a little bit in depth in certain topics. So if you're wanting to know specifically more, I've definitely referenced some of these videos because we are focusing more tonight on those sort of stop gaps and making sure we are putting kind of that time in place to intervene in some way. So medication misuse or medicine misuse, it's important to define a few things while we're talking this evening so that we're all on the same page. So what misuse is taking a medication in a way that's not prescribed, in the sense of taking more of it, perhaps taking medication for a different purpose for something else. You know, say you are taking cough medicine, but you don't have a cough. Taking medication that is prescribed for a different person is also considered misuse, because you always want to be in conversation with a medical provider, because it could impact you differently. Say if I took something that you have, it might impact me very, very differently than it does you. It might not work the same way, or in combination with other medications or substances. So just in general, not as it was meant to be used. That's what we mean when we say medicine misuse. So prescriptions in general or medication can be sold illegally online, or you can also get them from dealers out in the world. And these medications are not often what they claim to be, and can potentially contain deadly amounts of fentanyl. I do know there's other presentations that have happened around fentanyl if you want some more in-depth information. So I'm just going to go over it real quickly though. King County has been really intentional because there unfortunately has been quite a few deaths in our communities around fentanyl. So this is just some information on what does it sort of look like. It's often found in oxycodone or Percocet pills that people buy on the street or online. They're most often fake or cut with this substance because it makes them stronger and also cheaper ultimately. It can be found in white powder. So how to prevent it: don't use anything from the street or online if possible. Don't mix drugs. Also, don't use alone. So if you do know anybody who is using any of these substances, making sure that they have somebody else with them, so in case there is some sort of overdose, they can intervene. Also, if you do have someone in your life who is using opioid or prescription drugs in general, it could be useful to have Narcan or naloxone on hand. This is, again, another way to intervene if somebody is overdosing, and almost anybody could administer it. It's fairly simple, and then you can call 911 to get additional help, and obviously call 911. Some of the symptoms to be looking for in an opioid overdose: abnormal breathing, so slow or stop breathing, or gurgling, snoring sounds. If the person can't be woken up or nodding off, that can be a really big indicator or sign. Also skin changes, so if they're cold, clammy, gray or blue skin. And again, you could find a whole bunch of information because King County's been really intentional on this, because we've, again, unfortunately had quite a few deaths in our community.
Yeah. And Delaney, I was just thinking too that, you know, on that first slide about the fentanyl, it might not be you or someone that you know or in your family that you're concerned about, but taking that opportunity to educate and to share that information out into the community, because it is a public health issue. So that's us kind of working to support our community.
Yep, thank you. Thanks, Christy.
Yeah.
Another thing to define, because I quite often hear people misuse this, is overdose. What is the definition of overdose?
Dogs now, sorry people.
Sorry,
These are the
likes
pros
to,
and cons both of working from your home office.
my cat's basically a therapist now too, so she was giving her 2 cents on overdose. So one thing that's important to know is overdose does not actually mean death necessarily. People use this incorrectly. Sometimes people will be like, oh, you know, they overdosed, and then people will assume it means that they have passed away or died. But an overdose simply means you have put too much into your system, and your body can no longer function the way it's supposed to. It does not necessarily mean it ends in death. And so overdoses can be accidental or intentional, and we will talk a little bit more about that, just to define that for folks. So medications are harmful when misused or taken accidentally and cause potential damage, like we've mentioned, in terms of organ failure, death, and overdose. And accidentally taking too much medication can happen in a variety of ways, such as young children mistaking it for candy. There's been quite a few cases of that happening with some of the THC gummies, things like that. And also, it's just easier to keep medication out of reach for younger children, but it's also just important to make sure you are locking it up in a way that makes sense and people can't get into it. So as Christy kind of mentioned, why do teens misuse over-the-counter and prescription medications? Most teens are aware. I mean, I work in the Lake Washington School District. Most teens are aware of the consequences and know the things like, you know, this is your brain on drugs. So why do they still continue to use? I think it's important for us adults to acknowledge that so that we can come alongside and actually have conversations. So 4 primary reasons youth use: curiosity and new experiences. That's literally part of the adolescent experience and how our brains are wired when we're growing. We want to experience new things. It's part of being a youth. They also might use to change their mood in terms of having fun or experience pleasure. Also, the term self-medication comes up in this situation where they might use to alleviate emotional or physical pain. In the sense of, like, say they have extreme anxiety and don't have the ability to see a therapist to talk about it, or don't know that's what they need to see a therapist for, and they take a substance and they realize, wow, hey, this actually makes me feel better. Of course, I'm going to continue to use it. And then also potentially to end their life either impulsively or by having a plan. So over-the-counter drugs, these next few slides are just for your information as parents to know what is out there and what youth are using to get high. Over-the-counter, again, over-the-counter drugs that are listed that I know of youth who have stolen from QFC, for example, or whatnot, can be I'm totally going to mispronounce these. Christy, can you help me out? I don't remember how the dextromethorphan.
Dextromethorphan. I think there's missing some a vowel in there, but yes, DXM. I think we're just all going to stick with the DXM.
That's usually what I refer to it as, and I was like, oh, I should probably try to read this. So basically, that's any cough or cold medication. You can take, you know, again, just kids will steal packets, and especially with the triple C's is what they call it, the codeine. And instead of taking 1 or 2, I mean, if you've ever had a cold, I'm sure you've taken something like this, but instead of taking 1 or 2, they take 16. And that has an impact on them. Basically anything that has alcohol in the ingredients, such as cough syrup, again, antihistamines, caffeine pills, melatonin, and then of course recreational cannabis is considered over the counter these days, but is illegal for anyone under the age of 21. Prescriptions, medications to be aware of too, anything opioid, painkillers, oxycodone, Percocet, codeine, again, codeine cough syrup. We have our benzodiazepines. Xanax is probably the most popular one. Most people are familiar with Valium and Ativan. I always think it's really interesting if you listen to some popular music these days, like Billie Eilish totally has a song about Xanax. So, you know, just being aware of that. Stimulants and amphetamines, Adderall, Ritalin, kind of sort of the ADHD medications most folks are familiar with. And again, also medical cannabis, because that would be prescription. So it's important also to note that sometimes when someone starts using substances, they will continue to take because they don't want to have to experience the withdrawal. And that could be another motivator for continuing to take substances.
And that can be a really strong motivator because, I mean, withdrawals, for example, from opioids are very, very unpleasant and very, very physically debilitating.
Yep.
So your whole body is screaming at you to not go into that and to find something to take, which also increases risk-taking behaviors, like with being willing to take something that might have fentanyl in it.
Yes. So what does this also have to do with suicide and suicide prevention? Rob kind of hinted at this a little bit already, and Christy has as well, of this medications in particular are a more common, more popular version or choice of method because they're so easily accessible. They're in our homes. I can't tell you how many kids I've talked to where you ask and they're like, oh, I don't know, I'll probably go find something in the bathroom. And that would be how I would choose to end my life. But one of the good things, I guess if there's a good thing about that, is more often than not, there's time to intervene. So I have definitely worked with kids who took a bunch of something and then they realized, whoa, this was a mistake. And then they told parents and parents were able to take them to the ER, or parents found them throwing up. You know, what's awesome about our bodies is they do try to things to keep us alive, like throwing up or, you know, passing out or showing sort of some sign or reaction. And so what's important to note is that sometimes these things are planned, so they'll involve researching and accumulating whatever the substance might be. So it's important to note that sometimes even the things that seem least lethal, like Tylenol, if taken in large amounts, it can be lethal or cause problems. for
And
folks.
particularly paying attention to that any of those substances, if easily available, combined with alcohol, can really multiply the effects in ways that we can't really even predict.
Yep. So important to note, similar with firearms, I'm sure the firearms folks will talk about this, but teens who misuse medication most often get them from their own home, a relative's home, or a friend's home. I did mention, some kids steal things, of course, but more likely it's going to come from either my medicine cabinet, your medicine cabinet, or some friend's medicine cabinet. So signs to just look out for, similar to other things when it comes to mental health. Rob mentioned decline in grades, skipping class, lack of interest in things that the youth liked before, change in friends, acting in ways that are out of character, personality changes, and then being secretive. Knowing your teen is just always really important when it comes to things like this. Physical and emotional changes can happen, such as sleeping long hours, being awake for long hours. It's kind of like always one side and then the other side. Showing signs of depression, anxiety, anger, and then being super hyper, or on the other side, being very lethargic. So what should you do with over-the-counter medications or prescription medications now that I've said all of these things and you're kind of like, oh, what is in my medicine cabinet? I actually would encourage you, once you guys leave this call, to go look and see. I often do that when I am at my mom's house because she has a habit of keeping things for a very long time. And I find things that have my grandparents' names on them, and they have passed away a while ago. So what should you do? First thing is lock it up. So you can store it in a safe or a cabinet or a lockable box, whatever makes sense to you. Similar to when we were talking about firearms, where's the key, who has access to it, where is it going to go? So those are options for you, as well as monitoring. So keeping track of the number of pills that are in a bottle, pill packets, and just keeping track of use and refills. Making sure that you notice, is this prescription that you take, say I had had my wisdom teeth removed and they gave me a bunch of Percocet and I knew how many were in there, and then suddenly there's not that many in there, even if it's just one or two, that could mean something. There's somebody, took it or decided to take it or test it out or try it. So just monitoring how much you have is also really important. As well as supervising. If you have a child or a teen that does use prescription pain medication, an adult should make sure that they are taking it as prescribed and track the doses. Also, some families will do this with ADHD and anxiety medication. I did this with my dad when he had back surgery. The thing is these medications, especially opioids, are so powerful that even if you're just taking them as prescribed, when you have your wisdom teeth out, you can still experience withdrawals and most likely will. I know that I did even when I took it as prescribed, which
you're experiencing withdrawals because you've developed a physical dependency, or
yep.
Addiction is the other word for that. So it has nothing to do with kind of wanting to use drugs or get high. It's really is the body's response to it. They're just that addictive or habit forming.
Yep. So just being careful and aware, just an awareness of that is important. And then also just reducing how much you have available. I know it is super easy to just go to Costco and buy a giant thing of ibuprofen, saves money, all of that. But thinking about, if you have those sort of things, keeping the larger bottle locked up and only having what you need, just having a small bottle with however many pills in it that is just available for when someone has a headache. And then, when it runs out, great, then you can just refill the smaller bottle from the larger one. But just making sure you have those locked up, because those can be lethal if ingested in large amounts. Pretty much almost anything can be when ingested in large amounts, or you get really, really sick, which you don't want either.
And I was going to say, kind of, Delaney, about that last point, that I'd love that to be just as the same as, like, you prevent access if you have a swimming pool, because you don't want somebody just, who knows what could happen, right? It's not that somebody's intentionally planning, or you have the whole neighborhood just waiting to kind of have an accident in your pool. It's just something preventative that you do.
Exactly. And just be thinking about it, because it's easier to prepare for it beforehand than being in a situation where you have someone in your home who might consider using them. So recently there's been a big campaign of not hanging on to medications. I actually saw some of these when I was at the light rail station in the International District. So what do? Participate in Drug Take Back Day. You can also use medicine disposal kiosks or drug mail back. via these websites. You can also go to your pharmacy. You can just go ask them. You can also take it to the police department or the sheriff's station. They will accept things as well, or they can tell you where you can dispose of it. And they also sometimes have these really cool dispose prescription things where there's this like little baggie and you like dump the pills in and then you put water in it and there's like chemicals and it does its thing. That is very much preferred versus sticking your medication in like cat litter. I've heard people say they do that, or like dumping it, just in general, or dumping it down the toilet or flushing it. I mean, those are all options, not preferred because they're not great for the environment. And then I guess, if you're super desperate, I would imagine people would still dig through cat litter, which sounds really gross, but being aware of that. So there's lots of options, but thinking again about not keeping things that are expired, not keeping things that are not for you. Once that surgery is done, if you do have any extra medication, making sure that you dispose of it appropriately is really important, and not keeping it around. And then I will toss it back to you, Christy, for the next
Thank
person.
you very much, Delaney. We're just going to move right along and invite Isabel to share with us some really important information about firearms safety. So this is really, considering if you've made the choice to have a firearm, what can you do to build in that safety and kind of that protection that Rob was really encouraging us to do. Isabel, thank you.
Appreciate that. And thanks for that information, Delaney. And I just want to extend my condolences, Rob, again. And I do appreciate you sharing your story and your courage to do that. So I am Isabel Sakamoto. I work at Seattle Children's Hospital, suicide and injury prevention. And part of that includes managing some safe firearm storage, education, and giveaway events across the state, and sharing information on safe firearm storage, mostly tailored to parents and caregivers of children and teens. Full disclaimer, I'm not clinical, don't interface directly with patient families, but do get some opportunity to collaborate with some of our clinical teams to offer some of this information to patient families. And so here we go. There may be a lag here. So I am just going to cover some introduction as to what safe firearm storage is, some context, just a little bit of data, but I won't get too much into the weeds of that. And importance of safe firearm storage, some different options that exist, and we'll just touch briefly on conversations about safe storage and kind of normalizing those before there's going to be another presentation later on that dives a little bit deeper into that. So first of all, what is safe firearm storage? Is defined by Washington State in their legislation that having a firearm unloaded and secured using a lockbox, safe, or other locked storage space designed to prevent access and use from someone other than the intended owner. So when we think about safe firearm storage, we can consider it from a couple of different angles. So there's this general home safety component, unintentional injury prevention in mind, right? So oftentimes with kids who may be naturally curious, may be tempted to play with a firearm if they find one. And we even know children as young as 3 years old are strong enough to pull a firearm trigger. There's also safe firearm storage through the lens of suicide prevention, right? It's one layer of suicide prevention. So the idea here is that safe firearm storage is placing time and distance between someone who may be actively thinking about suicide and taking action. So especially with younger children and teens, again, if it's more of that impulsivity, seconds can really make a difference. And so safe storage is not a blanket solution to these challenges, but is an important layer of prevention.
Mm-hmm.
And so why does this matter? I think it's, I don't really have to convince anyone why it does, but in general, right, we want to help keep kids safe from firearm related injuries and death. And we know that safe storage will help keep them safe. And just for some context here, unintentional injuries and suicide, which both involve firearms, right, are top leading causes of death for those ages 1 to 21 nationally and in Washington state. And so in Washington state in particular, we have a suicide rate that's been consistently higher than the national rate for many years now. And we've seen that continuing to rise, unfortunately. Most of the firearm related deaths in our state are suicide as well. It's around 75%. And so this, this information has been true for years. But the last year and a half, given the pandemic, it's really emphasized these things as we saw firearm purchasing spike in 2020, including a lot of new owners who had not, owned firearms previously and may not have as much knowledge at this point or yet around safe firearm storage potentially. And so thinking about more firearms being in more homes, more people spending time at home over this last year, experiencing isolation, potentially with some kids just being at home more often, but maybe not having as much supervision as parents or caregivers would like to provide given their own situations with work and things like that. And then high concerns for mental health and depression have been very prevalent this last year, and not only this last year, but especially over the last year and a half. And so naturally, the combination of these things has raised some concern, especially because similar to medication, right? We know that most firearm related incidences occur in or around the home, which is why it's so important to safely store firearms at home, even if a child or teen has had firearm safety training, they're familiar with using them, or if you have kids or teens who spend time at your house, even if it's not kids who live with you regularly, but considering those who even may be at your house occasionally. And so, like we've kind of mentioned already, right, we can think of firearms like other potentially dangerous household items, like prescription medicines or over-the-counter medicines too, for sure. And again, just with that suicide prevention standpoint, it's a way to create some time and space between someone and a firearm. Firearms, unsurprisingly, right, are the most lethal form of suicide, and so just another emphasis for safe storage. And again, hidden isn't safe necessarily. And so, how do you store firearms safely? The most effective way that we know is our method for safe storage is what's referred to as triple safe. And so that means storing a firearm unloaded, storing firearms locked up, and then storing ammunition locked up in a separate location, ideally. And so that is what we know to be the most effective. And people may be on a spectrum of doing one or some of these components, which is great as well. But this method is the most effective for keeping them out of the hands of anyone other than the intended owner. And so this image here, just wanted to plug Seattle-King County Public Health's Lock It Up program. They partner with firearm retailers in the county, primarily in King County, to offer discounted prices on gun safes and lock boxes. They have great information and brochures on different options for safe firearm storage that we can share after this. And then some types of firearm locking devices. There are so many different types of options out there. These are only a few. These are what we distribute at our community events. And so we have a combination lockbox that fits most handguns or firearm ammunition. It's made of steel. It's it's transportable. You can carry it in a car, in the home. Combination trigger lock too, which fits most handguns, and then these keyed cable locks, which fit most handguns and long guns. So many different options to suit needs beyond this as well. These are just a few different options. We typically recommend combination locks over keyed locks because kids often know where keys are kept, and then of course keys can get lost. And so the combination lock sometimes works better, especially if we're choosing combinations that wouldn't be easily guessed by others. And then sometimes there's a hesitation around storing firearms, right? Especially if there's a concern for home defense. And really, based on my experience, you can, with practice, you can unlock one of these devices and access a firearm if needed very quickly. If you are the one who knows the combination and where this is stored.
And it sounds like that could even be part of training, you know, yourself, or if you're participating in some kind of firearms training.
Definitely. Yeah, just kind of practicing and getting some hands-on practice with that regularly definitely will help. And so this is just a little bit, this is some research, public health research that we have found that safe storage of firearms can significantly reduce self-inflicted and unintentional firearm injuries in the home. This particular study was research done by Dr. David Grossman from the University of Washington in Harborview that showed that safe firearm storage practices are associated with a significantly lower risk of firearm injury among household members. And this particular study found that safe storage can reduce firearm suicide, unintentional shootings, and shootings with handguns and long guns, all by at least 75%.
That's powerful.
It
That's
is.
effective.
Yeah, yeah. And so again, safe firearm storage is an important preventive measure, but it's not the end all be all. And so there are times when safe storage isn't enough. And so there are options for temporarily removing firearms from the home if someone is experiencing depression or suicidal ideation or using drugs or alcohol, and it can make a difference. And so, you know, depression is common among teens, especially. We know 1 in 5 teens will go through a period of major depression by the time that they're 18. And so, of course, not everyone who experiences depression also experiences thoughts of suicide, but if there is concern, we want people, you know, to feel like they know what they can do and that there are resources available to help. So I'll share this after the presentation, but this picture is of a firearm safe storage map developed by Harborview Injury Prevention and Research Center for people to easily find locations in the state or in their area of where they can temporarily and voluntarily have their firearms stored outside of the home. And then, of course, crisis supports, as were mentioned previously, are available all hours of the day. They're accessible through phone and text, through the Suicide Prevention Lifeline and the Crisis Text Line, and would definitely recommend just anyone having these numbers programmed in your phone, because you never know when you may need them.
Absolutely.
And then just very briefly, discussing safe firearm storage, it's not something maybe that's been normalized yet. So it's not always comfortable to discuss with your child or with other adults. But we know that research shows that like 93% of parents, including parents who do own firearms, would be comfortable being asked about a firearm in their home, as long as those concerns are presented right without judgment and with respect. And so again, we can approach this as a focus on the safety of our kids and community, just like as Christy was mentioning, right? You make it a habit to put a bike helmet on before you ride a bike, strap your seatbelt on in a car, you put your life jacket on when you're going onto a boat or when you're going to be near the water. We can also lock up firearms to avoid injury or death as another safety measure at home. And we'll be sharing some more information too about this, but afterwards with some resources available after the presentation. And again, just safe firearm storage, right, protects children, reduces the risk of injury, and saves lives. And I would just also plug here, right, encourage to always ask directly about suicide if you do have any reason for concern for a loved one.
Right. Yeah.
Please feel free to contact me if you do have questions or want additional information. And then these are just some links to some pages on our website with safe storage map that I was showing, the Lock It Up program, it links directly there too, and then some home safety strategies and other information on mental health.
Great. Thank you, Isabel. You know, I so appreciate that because, you know, even after years of working in mental health and substance abuse work and talking with many, you know, families about safety in the home and are there guns and are they secured, but the details about different types of locks and thinking about how do you store a firearm at a time when you think there's heightened risk, whether for yourself or for someone else in the home or a friend. I mean, I had never even really kind of thought that through about, you know, the ins and outs of the legalities of that, and that you can't just like, here, keep my firearm for me. And, you know, that there are legal issues around that. And so, Alyssa, you're going to sort of talk to us about some of the options kind of built in around those that you work with, and kind of flows right from where Isabel left us. So, Alyssa.
Yeah, thank you all so much. I'm so grateful to be a part of this really important conversation tonight. So I will caveat and say that I am not an attorney. I'm a social worker, but I do work for the Seattle City Attorney's Office. So I'll do a formal intro. My name is Alyssa Shaw. I'm the Extreme Risk Protection Order advocate with the Regional Domestic Violence Firearms Enforcement Unit. That unit, we are a collaboration between the King County Prosecutor's Office, Seattle City Attorney's Office, where I work, and then our law enforcement partners, the Seattle Police Department, King County Sheriff's Office, as well as really all jurisdictions. We work primarily in King County, but the what I'm here to talk about, extreme risk protection orders, is a state law. So it doesn't matter where you're living in Washington State. If you're watching this, the law applies. Just our work is centered around King County. So when I'm talking about the advocacy that I provide, that's primarily in King County, but anyone in the state can get in touch with our office and we do our best to help. So I'll go through, and you know, I'm just so grateful and really in awe of Rob. Thank you so much for sharing your story, and my also condolences to your whole family. I think that, you know, I've got some stats here about suicide, but Rob's story shows that, you know, even one life lost to suicide affects so many people, a whole community, and like our previous speakers mentioned, Isabel mentioned that it's a huge problem in the nation and here in Washington State. So here's just some statistics, and what I'm so grateful that we're talking about suicide when we're talking about firearms is because usually the gun violence prevention movement, suicides aren't really a part of that conversation. And usually when people talk about gun control and things like that, it can be very, very testy. You know, we're not going to get into anything but the facts tonight. But usually it's about homicides. And unfortunately, the statistics that we know are that the majority of firearm deaths are from suicides. And like the slide shows, 51%, this is suicides just here in Washington State. Over half of all of the suicides were from firearm injuries. So I like to say you can't talk about firearm injury prevention without talking about suicide, and you can't talk about suicide prevention without talking about firearms. So I'm really grateful for this conversation today. Again, like our previous, every speaker really mentioned, that the most effective thing you can do when you're looking to prevent suicide is to reduce lethal means and get time for that person to get the help they need, change their mind, whatever the case. And so, Rob, you asked if one of the speakers had the stats. So I looked it up because I didn't put it in this presentation, but I had it from a previous one. So 90% of suicide attempts that involve firearms end up resulting in a death, compared to about 4% of suicide attempts with other means.
Wow.
So it's just that gut reaction that you had. It's pretty straightforward, and the research and the stats really show that reducing the most lethal means that a person has to take their own life is a life-saving intervention. So if we can remove that firearm from a time when someone is suicidal, that's the intervention. Doesn't solve the problem, doesn't necessarily get them the help that they need in that moment, but it keeps them alive long enough so that all the other pieces can come together.
Absolutely.
And I apologize if there's some, I'm just getting the chat up here. So if there's questions, please, and feel free to interrupt me. I don't know why it's not coming up on my
Yeah,
screen.
that's
Sorry
okay.
about that.
Probably Val or Bonnie or someone will help us with that. So you can just kind of continue there, Alyssa. And
Okay.
I just wanted to just kind of underline what you had said about when someone is suicidal. And I know that you're specifically going to talk about that with this ERPOs. And also, we don't always know when somebody is suicidal. And people are impulsive sometimes, particularly young people, when maybe they've just gravely disappointed somebody or themselves or something, and they're having a momentary reaction. So practicing that locking up and the safe storage and the safety is important, kind of just always, because you just don't know for sure.
Absolutely, absolutely. And I think that this this group of presentations that you put together tonight is so reflective of what I see in my work, which we usually, when we're talking with family members, we want to talk about how, you know, families, they have a menu of options. One of these pieces is not the end all be all. Doing the things that work for, you know, depending on what, there might be some homes that don't have medications in them. And so it's okay that that's not a piece. But again, knowing this information, so you know, well, what about the homes where my kids are going? Even if it's not happening in your home, it's really helpful to have this information so you're not caught in a situation where you don't know what to do because it might not be something you have in your home. So all of these, it's the whole purpose is just to let people know all the different options that are available. And of course, you know, I work in the legal system, and I understand that by the time things get to coming across my desk, typically families have tried everything else that they could. It's not a step that people take lightly, and we definitely understand that. So what I want to talk a little bit about is what we do every day, extreme risk protection orders. And you guys may have heard these orders talked about on a national level. Usually they get brought up after mass shootings. They're often referred to as red flag laws in other states. There's no federal extreme risk protection order law. There's only certain states that have them. Right now, I believe it's up to 15 different states that have some type of extreme risk protection order law. They're called different things in different states. California's is called a gun violence restraining order. But the whole purpose is exactly what we're talking about, to intervene and prevent a tragedy from happening. So one message that I want, you know, families to know is that there are actions that you can take to prevent harm from happening, whether that's safe storage, locking up your medication, or talking with me about an extreme risk protection order. I just want families to know that this is not a problem that we can't solve. There are things that we can all do. So what exactly is an extreme risk protection order? It is a civil court order, and I'll get into the specifics of it later, that allows family members and law enforcement to go to the court and ask for the court to remove the firearms from someone who is exhibiting signs of danger to themselves or others. So our law, again, here called an extreme risk protection order, sometimes we'll call it ERPO for short. It was passed by a citizens initiative in 2016. So the citizens of Washington state came together and said, this is a tool that we want to be able to use in our communities. So that law passed in 2016 and took effect in December of 2016. One thing I'll mention just with our unit, we didn't start by doing these extreme risk protection orders. Our unit started in January of 2018, so it had already been in place for a little over a year before our unit got started. But a month after our unit got started in 2018 was the school shooting in Parkland, Florida of the Marjorie Stoneman Douglas High School. And it really reinvigorated the conversation about these extreme risk protection orders and what can people do when someone like the shooter in that case was exhibiting signs. People knew, people were worried, and they didn't have a mechanism to intervene. So of course, you know, sometimes we don't know when someone is suicidal, and sometimes they're telling you, and we need to be able to have tools to intervene when we know something is going on.
And that was a young person. I mean, a young adult by then, but a young person.
Yes, I don't know if he was technically over 18 at that point, but yes, definitely still a young person. So when we talk about, you know, and these are not only behavioral signs for us to be aware of, but these are some of the signs that the court is actually looking for when they are deciding whether or not to grant an extreme risk protection order. And the one thing that we really want to make sure that people are thinking about is, you know, yes, there are these factors, but we're really looking at someone's words, actions, and behaviors. So if they're saying they are suicidal, wanting to take their own life, and then, of course, you know, having those conversations, we want to make sure that we have specific words, actions, and behaviors that we can point to show why they are a risk to harming themselves. So again, into the specifics, and I won't go too much into it, but I just want everyone to know if you have any questions about any of this. That is my whole job, is to answer questions and talk with people, even if an extreme risk protection order might not be appropriate right now. But generally, here are the big pieces that we want people to know. So again, it prohibits someone from purchasing and possessing a firearm for up to 1 year. There is an entire court process. There's due process protections built in. So it's not something where, you know, someone can just go in and take someone's firearms and they have no say in it. There are full due process protections built in. But it is a mechanism to remove the firearms if someone already has them. And then another important piece is that it can prevent a legal purchase. So it might not mean anything to most people that it gets entered into these weird acronym databases at the bottom, but it is important on the legal side, because if there's an extreme risk protection order in place and someone goes to purchase a firearm legally, that will come up on their background check and prohibit them from lawfully purchasing that firearm. So it's really important, if you are working with someone or know somebody who is suicidal and they're talking about, you know, oh, I'm going to go purchase this firearm to take my own life, this could still be an appropriate tool to use, even if they don't have one in their possession yet. One other thing to mention is that an extreme risk protection order does not offer any physical protections. So couple sides to that. The positive side is if you are needing to petition for an extreme risk protection order against a family member, that means you still have contact with them. You can still be their support person. You can explain to them, you know, I'm doing this to remove this lethal means you have. I'm doing this to save your life. On the opposite side of that, if you do have any concerns for your physical safety, we can talk about maybe what other type of order could remove the firearm as well as provide you some physical protections. So just want to mention that piece
So, Alyssa, we have a couple of questions
Oh, yes,
that
please.
have come through.
Yeah.
And one of them is, you mentioned when you started that you often see people just at the end where they've tried all sorts of things. But when is the best time to actually access an extreme risk protection order?
I think that is up to the family member. I think this is one thing I forgot to mention, which is a good point to bring in here. It is lawful for someone to temporarily remove the firearms of someone else if they're suicidal. So I'll give a more concrete example so my wording is not confusing. So if a mom has concerns that her adult son is struggling, knows he has a gun, and maybe he relapsed, maybe he is struggling with suicidality, mom can take that gun from him. Even if it's registered to him, mom can remove that gun temporarily and keep it at her own house. So that's one thing that I've seen a lot of family members do, where they'll say, I took the gun, we've got it locked up at uncle's house, we've got it at grandma's house, something like that. But they still are worried that either, that the loved one might not want to be the one to have to decide whether or not to give it back.
Right.
And so there's a lot of situations. And I would say if you have any questions and just want to talk about your situation or just talk in hypotheticals, you can always call.
And we'll include your number, but is that also, you said that a mother could do that, but can other family members or friends for that matter?
I have it right here on this next slide. So under the law, there are two buckets of people that can apply for an extreme risk protection order. The first is law enforcement, and then the second is a family or household member. So here's the list of folks that can petition. But just family and household member is the big one. Unfortunately, that leaves out friends that you don't live with, neighbors, teachers, mental health professionals, doctors, things like that some other states have written in that some of those folks can be petitioners. Unfortunately, here it is limited at this moment to family and household members, but it's still pretty broad. I mean, roommate within the last year, and then any sort of blood relation, and then dating partners is, I think, really important to make sure of, and that's dating partners, even if you don't live together.
So we have another question that came in, which is it possible for them to find out who reported them, and when will they get their gun back?
So this is where it gets tricky with family members, is that the family member is the petitioner. And so right after you petition, so there's the two legal terms of petitioner, that's the person who asks for the order, and then the respondent, who is the person who is subject to the order. So we'll stick with this mom and son example just for continuity. So if mom petitions for an extreme risk protection order, she gets a temporary order granted by a judge. That order, everything she wrote in her petition gets served to her son. So all the concerns she has, the fact that she's the one who did it, it's part of the due process protections, is that the person needs to know who is making these allegations and taking my gun away. So it gets tricky. I'm not gonna, say that it doesn't get messy with family members, but again, this is what we're here for, and that's a conversation I'm
Right.
have fairly often with family members to say, here are your options, but you have to do what's right for you. And if this is going to ruin your relationship with your son and you're the only support person he has, let's think about, getting you a safe storage lock. Let's think about some of these other tools that might be more appropriate. So it's messy.
We have one other question that came. Oh, when will they get their gun back? That was the.
Oh, yes, sorry. So again, the order is valid for up to 1 year. So if a full order is granted, it will be up for 1 year with the possibility for it to be renewed. So it really just depends, but the basic answer is 1 year.
Okay. And then one other question that came in was, what should I do if I hear from my kid that his friend is thinking about suicide and I know that their family has a gun in the house?
That is very tricky. Again, looking at this list, you are not a family or household member of that other parent's house. So I think one of the themes of this talk is conversation, and to definitely make sure that the parents of that child know that their child is suicidal. Definitely be asking, just like our, the previous speakers talked about, asking, are there guns in your house? Because that might be something that their child is, that might be the means that they're thinking of. So I would say definitely start with a conversation with the parents. And then if, again, we're kind of going through these various steps, but if it gets to the point where you really do have serious safety concerns, I of course have to advocate for calling 911 if there's no other option.
If it's the immediacy. And just one thing, Alyssa, that I wanted to mention was that if your child is still in school, and for example, in Lake Washington School District, our behavioral health support specialists provide suicide risk assessments and consultations, and you can find out how to access that, and you have someone you can talk that through with, and make decisions about, how to get in touch with that friend, how to intervene, etc. And so really, having somebody help you work that through, but to make sure that it does come to the attention of the people who need to have it front and center, so that they can take whatever measures are available to them to keep someone safe.
Absolutely. And my apologies for going over time, but I'm really grateful that there were so many thoughtful questions. And I don't have my slideshow up, but my contact information will be in the slides that go out. The best way to get in touch with me or our team is you can email erpo@kingcounty.gov. And I'll put that in the chat for everybody.
Great. Thank you so much, Alyssa. And I know, all of these resources will be available to you afterwards, and Val at the end will tell you all how to kind of access them. And Delaney and I are going to just sort of kind of walk through some ideas about having that safety conversation with another parent, for example, and a sort of the beginning of kind of starting this, normalizing this safety conversation, just as you would be talking about any other kind of safety there. So can we go first to the other one, talking to your parents? Great, thanks. I wanted to start with this one because when Delaney and I were talking about this before, we realized that there's talking with your kids that comes before and may come after this conversation. Our hope is that you have been having these, will be having these conversations, with your family, with your own youth, and looking at, setting up kind of your expectations, directives, that education piece about this. Even this presentation is a good sort of kicking off point to say, hey, I went to this and I want to talk with you. And so we're going to do that after we start here with, what are you going to do kind of with the other parents in the households? And I remember kind of from either the first or the second forum that we did, it stuck in my mind that Rob had said, he just became so aware of how important it was to have that conversation with other parents, to say, it is fine with me, whatever decisions you're making in your home. This was around substances. um, for you and for your children. But I don't want my young person, if they're in your home, exposed to alcohol, being invited to be using that or other substances. And so it's really a matter of being able to kind of share with other adults what your values are for your family and for your youth. It isn't about telling them what is what for them. All right. So I'm just going to kind of pretend like, Delaney is another parent and maybe we're kind of on the sidelines of a soccer game, and both of our, let's just say 14, 15-year-olds are on the soccer team, and they've started, kind of saying, yeah, they're becoming friends, they're going to hang out together. And so I'm kind of standing there. And when we did this role play, his practice, Delaney's like, wow, Chrissy, you just dove right into that. You didn't even ask me, hey, would it be okay if we talked about this? And I said, well, yeah, I know that's kind of my style, and I probably should back up and kind of do more of that permission asking. However, I don't want someone to like say no to me. So I am going to pay attention to what the circumstances are. I mean, are we kind of like, we talk about coming alongside your kids and having conversations? Are we kind of alongside of each other so that there's not this kind of like, I'm in your face kind of thing? And it's more natural. It's, somewhat private, but it's not like overdone so that it's casual, right? And you can kind of take the onus of the discomfort and the weirdness and stuff on yourself. This is a therapeutic technique, actually, they teach you early on. It's like, other people are going to feel awkward, so take it on yourself. So it's sort of like, I know I'm a little weird asking this, but here we go. Hey, Delaney, so, Joe and Aaron have, seem to really be getting along, and I'm kind of thinking, probably we're going to get to the point where they're going to be in each other's wanting to hang out together kind of, at home or out and about. And, I've really started on this kind of thing about making it a routine where I share with other parents where my child's going to be going and hanging out with them, or they're coming over to our house, kind of how we're handling safety at home. So around like, over the counter prescription medications, alcohol, drugs, and firearms, just other kinds of, kind of hazards and things like that. And so I wanted to just kind of have that conversation with you, while we have a minute here. So in our house, we lock up kind of all the medications, and I kind of keep that, I buy the big Costco things, but I kind of keep them, those locked up. And then we have kind of the small, Tylenol or Advil or something for kind of daily use in that. And for sure, if we have kind of like opioids, because, I don't know if you've kind of heard so much about how, had a lot of overdoses in the community. And, our families just had friends where, there've been some tragedies that have happened where there's been suicides and other things. This is partly kind of why this is kind of on my mind, right? So that's kind of our practice, and we don't have firearms. And I it's everybody's choice about whether they have firearms or not. I don't presume to kind of, put that on you and your family. And I know a lot of people do for various reasons. But it would be really important to me that if you had firearms in your home and my son was going over there, to know that how they were secured and that they were secured, if that makes sense, right? So how about you? I mean, kind of, do you guys have these conversations at home, and what are you doing about these things?
Well, some of that I actually don't know if I've thought about. I do buy the Costco bottle as well, but I mean, it should be fine, right? Like, there's not anything to worry about with that. Like, what I don't. Why would you lock that
Why
up?
would you worry about that? Yeah, I
Yeah.
know. I mean, I didn't think about that before, but I had a friend who had an experience where their child was just kind of going through a rough time, and they were kind of upset, and they're a pretty impulsive kid, and they had that, just like, well, you take it for your headaches, right? So there they were, and all of a sudden, it come to find out, the kid comes to the mom in some distress and says, I was really upset. And at that moment, I just wanted to die. And I just took like half of that bottle. And, had to go to the hospital, and, apparently, the Tylenol is really, really destructive to your liver. And so fortunately, the child didn't die from that, different than maybe some prescription medications we could think of. But I think she has kind of long-term liver damage. So yeah. Yeah.
Wow. Like I said, I hadn't thought about that. I mean, I do, now that you mention it, my spouse does have a handgun, and they keep it in the closet, but I don't know if, I mean, I don't touch it. So I don't know how he
Right.
stores it. But that's good to check in and ask about, because I've heard of things happening as well. I guess it would be the same, if my son came over to your house and you guys had a boat,
Right.
I'd
Right.
want to know if you guys were wearing life jackets or not, right?
Absolutely, you would. Absolutely. And we
sense.
do have a boat, and we do have life jackets, and we do make sure they wear them, and we don't let them go out, yet unsupervised, and they have to kind of, sort of prove themselves to kind of get there. Yeah. And would you be willing to kind of have this conversation, at home about the gun, and maybe think about the medications, and then just, fill me in whenever. And if you have any other questions for me, I'm happy to hear them. So.
Sure. Yeah, I will. I'll talk to my spouse about it.
Okay, great. And so pause on that. I want to put up real quick the teen one, and just talk some about, after this, then what came up is that we might want to go and say, hey, to my son, I was having a conversation with your friend's mom about kind of medications and, firearm safety. And how we have always taught you, if you see a firearm and it's not secured, do not touch it. If people are, playing with it, you need to call us and leave the situation. You can always call us when you're uncomfortable or feeling unsafe. And so I just want to kind of reiterate that, because I'm kind of waiting to hear sort of what they're going to do about some of the safety issues in their house. So might be waiting before you can go over there. But if you were to be there prior to things being changed, I want you to really be on alert, and kind of follow those agreements that we have about the not using substances, even if other people are doing that, or if that's offered to you, leaving the, the firearms away. And if anybody's messing around with those, then call and get out of there. So I just wanted to let you know, and you got any questions or, concerns about that, we can talk about it. And you can definitely have, him over if it's fine with his parents as well. So yeah. So a lot of this is just the get prepared beforehand. So, and start this. If you haven't started these conversations yet, start now. And, be casual, be informal, but also be to the point, right? It's like, I want you to be safe. These are the things that are important to me. This is what I expect. You can have kind of a safe way out if, they're in a bad situation. I mean, I think you say you can always, ask for a ride or kind of rescue, and, consequences, judgments, questions, all of that are secondary to let's getting you to safety. And I want you to know that. Just that general advice, we talked about this kind of over and over again. Come alongside, be calm, always be focusing on the relationship, listening, having a conversation, literally alongside. So going for walks, if something comes up on the TV and it's like a good spark for the conversation, those kinds of things where there isn't, again, that kind of face-to-face intensity really helps. And I know that Val has been working on a parent pledge and a family kind of parent-child agreement that we're going to have that help drive these conversations.
Yes, absolutely. This is an effort that we in Balance in Mind are working on. And you may be familiar with some of these things from PTSAs. I just wanted to say that I know our group is very interested in doing what we can to have those conversations and to help foster those conversations. So I wanted to, before I get to that, point out a few resources that we have. There are always the crisis text line, National Suicide Prevention Line, Lifeline, Crisis Connections, 7x24 are always available. Teen Link is a line that is active 7x24, but in the evenings it's hosted by teens. And both Crisis Connections, Teen Link, the Suicide Prevention Lifeline, and the Crisis Text Line are resources available to you on your own behalf, on your children's behalf, on friends' behalf. And I've heard from folks that man those lines, they say, we have people just calling up because they don't quite know what to do or where to turn. And that's totally okay too. Just think of those as a starting point. We've heard from Isabel, and SeattleChildren's.org has such great information. You will receive an email after this event, probably tomorrow, that has these resources in it along with other resources. And Alyssa's irpo@kingcounty.gov is there as well. This is the list. It's our comprehensive local list of resources for parents and kids, both for mental health, substance use, and safety. That will be included as well. Now here's the Parent Safety Pledge. We have two versions that you can use to talk with your family, that's the Family Safety Pledge, or with other parents, and that's the Parent Safety Pledge. Both of them have bullets and have a good structure to talk about safety, where safety includes not only alcohol and drugs, but also firearms. And one thing for us, we now include cannabis in there because weed is legal in our state and should be discussed along with alcohol since they're easily accessible. So this will be included. It is one of the tools that we have, that PTSAs have offered in the past and that we will be helping PTSAs promote going forward. Just a quick note on Youth Eastside Services. This will also be in your slide deck, but Youth Eastside Services offers counseling support for anyone. Regardless of ability to pay, but they also take every form of insurance that I know of. Christy, I'm sure can clarify that.
Well, that's for our agency-based programs, and yes, we do. So public insurance, private insurance, self-pay, the whole spectrum. And then this for the school services, where we're working on a contract with the Lake Washington School District that's at no cost to families. And there are services in the Bellevue School District that are similar.
Yeah, thank you. We want you to know that there are resources out there for you. And we thank you for being with us. Are there any questions remaining? Please feel free to ask them. If not, well, feel free to ask them, but I will just continue on and say thank you so much to all of our panelists tonight. It has been incredibly informative and both in a really great way and also kind of in a scary way. The scary part for me as a parent is not realizing just how prevalent firearms are in suicides, and also the fact that we tend to focus on one reason that's easy to understand for why our kids may be more at risk than we think of. Certainly from my point of view, I think mental health is the underlying mechanism that brings all these other substances, firearms into such danger for our kids. Christy, like you have something to say.
Yeah, I just wanted to echo that part where you're talking about how the mental health and where Rob had talked earlier about how people can want to latch on to one thing to explain it. And I think it is because it's so distressing. So we want to find what is the one thing that we could control. And that is really a part of a grief reaction as well, is to sort of locate, you know, kind of where my anger and distress can go. And so that's just a really good remembering to go back and think big picture and what are all of the different pieces and how can we respond and prepare ahead of time, as Delaney and Melissa and Isabel all talked about as well, so that there's just a safety foundation no matter what.
Absolutely. And, you know, one of the things that if you've been to any Balance of Mind parent chat or other event, one thing we consistently say and hear from our speakers is the importance of communication, and that, you know, where you are with the crisis or the problem that you're dealing with can be so tied to your communication, and having frequent communication about really tough subjects can have the downstream effects to make it easier to have those conversations when the situation is in crisis or is acute. Hopefully no one is in crisis, but just the importance of communication. And so what you saw with Delaney and Christy today is a great example of how to talk with another parent, which is so darn difficult to do. And we'll be posting the video so that you can practice on your own before you have your conversation with another parent. All of that will be available in the supplemental email that comes out. But back to thanking everyone. Thank you so much for being here, for taking your time tonight when it's a gorgeous Seattle night to listen to a somewhat heavy topic, but one that is so important for our community.
Thank you.
Yeah. Good night, everyone.
Bye.
Bye.